Did you know that you do not have to cut out carbohydrates to fix your blood sugar? In fact, the fastest way to bring your numbers down is actually more about adding foods, not eliminating entire food groups like carbs. I have seen this firsthand. I have hundreds and hundreds of patients who have turned their numbers around in just days by adding specific foods to their daily routine. And not just temporarily, they have been able to keep their sugars low without medications for months and even years. I'm Dr. Omer. As a physician, my work is grounded in evidence, critical thinking, and a careful evaluation of facts. I believe in explaining complex issues by examining the available data, verified sources, and the broader context rather than speculation. Today, I want to walk you through what's really happening here, why it matters, and how the evidence helps us understand the bigger picture. In this video, I am going to show you how to use each of these 10 foods to fully optimize your biochemistry and reverse insulin resistance on a cellular level, so you can bring your sugars down quickly and naturally, and most importantly, sustainably. Here is what almost no one explains to you in a 12-minute office visit. High blood sugar almost always starts upstream with a hormone called insulin. Insulin is the hormone that unlocks your cells, so glucose, that is, the sugar in your blood, can move out of your bloodstream and into the cell where it belongs. When you have spent years riding the blood sugar roller coaster, your cells stop answering the door, the insulin knocks, and the cell stays shut. We call that insulin resistance. Your pancreas pumps out more and more insulin to compensate. Your blood sugar climbs anyway, and the standard answer becomes a prescription that pushes even more insulin into a system that is already overwhelmed. The healthcare system generates revenue when patients remain on medications, not when they recover through lifestyle changes. That is economics, not malice. And there is simply no time in a short office visit to teach you how food talks directly to your insulin receptors. So that is exactly what I am going to do here. Every one of these 10 foods does one of 3 jobs. It slows the sugar coming in, it cools the inflammation that keeps your cells resistant to insulin, or it wakes the insulin receptor back up so your own body does the work it was designed to do. You do not have to add all 10 tomorrow. Introduce them over the next couple of weeks and stack them. Let me walk you through the first one. The first food is fenugreek seeds. These are small, hard, amber-colored seeds you can find in the spice aisle of almost any grocery store for just a couple of dollars. If you pass over this one because it sounds exotic, you are walking past one of the most powerful blood sugar tools on the shelf, and it costs less than your morning coffee. Here is what fenugreek does inside your body. The seed is packed with a soluble fiber called galactomannan. When it contacts the water in your stomach, it swells into a thick gel that physically slows how fast your stomach empties carbohydrates into your small intestine. Slower emptying means the sugar trickles into your bloodstream instead of flooding it. No flood, no giant spike, and no panic dump of insulin. On top of that, fenugreek carries an amino acid that nudges your pancreas to release insulin more efficiently and helps your muscle cells take up glucose. In my own practice, I have watched fasting numbers come down within a week or two on this alone. Take 1 teaspoon of whole seeds, soak them overnight in water, then drink the water and eat the seeds before breakfast. If the slightly bitter taste is too much, grind them and stir half a teaspoon into yogurt or over your eggs. Start low. This fiber is potent and your gut needs a few days to adjust. The second food is cinnamon, and you almost certainly already have it in your cupboard, but the variety matters and most people have the wrong kind. The common grocery store version is cassia, which carries a compound called coumarin that is hard on the liver in large daily doses. The one I recommend to my patients is Ceylon cinnamon, sometimes labeled true cinnamon. It is milder, safer to use daily, and far more effective for blood sugar. What makes it work is a group of polyphenols, natural plant compounds that behave almost like insulin themselves. They help your insulin receptors grip glucose more effectively and slow stomach emptying after a meal. Research from the Human Nutrition Program at the USDA found that less than half a teaspoon per day meaningfully lowered fasting glucose in adults with type 2 diabetes. Use 1/4 to half a teaspoon per day stirred into oatmeal, coffee, or a smoothie, and pair it with a carbohydrate meal because that is precisely when you want your receptors working harder. Third is broccoli sprouts, and I want you to pay close attention here because this is the most underused food in this entire video. I am not talking about full-grown broccoli, I mean the small, 3-day-old sprouts. Ignore that distinction, and you miss almost all the benefit. Broccoli sprouts are loaded with a compound called sulforaphane, and the sprouts contain somewhere between 50 and 100 times more of it than mature broccoli. Sulforaphane does something none of the other foods do quite as directly. It travels to your liver and quiets down the overnight glucose production process. Your liver makes sugar while you sleep, and in insulin resistance, it makes far too much, which is why so many patients wake up with a high fasting number they cannot explain. A 2017 study from Lund University in Sweden gave concentrated sulforaphane to people with type 2 diabetes and brought their fasting blood sugar down measurably, with the strongest effect in the patients whose sugar was hardest to control. A small handful, about a quarter cup, on a salad or sandwich most days is sufficient. Do not cook them at high heat. Eat them raw or barely wilted. The fourth food is avocado. Most people think of it as a fat to avoid because of the calorie count, and that fear is costing them. The fat in an avocado is monounsaturated fat, the same family as olive oil, and it is one of the most blood sugar-friendly foods you can put on a plate. That healthy fat and the fiber inside an avocado slow your entire meal down. When you add half an avocado to a plate of rice or toast, you are not removing the carbohydrate. You are putting a brake on how fast it converts to blood sugar. The glucose climbs gently instead of spiking. Over time, monounsaturated fat has also been shown to improve insulin sensitivity, meaning your cells answer the insulin knock a little faster. Half an avocado a day is a sensible amount. Put it on your eggs, mash it onto whole grain toast, or add it to a salad. Anywhere you have a carbohydrate, avocado softens the impact. Fifth is chia seeds. These tiny seeds punch far above their size. Chia is one of the richest sources of soluble fiber available, and when it meets the water in your stomach, it forms a thick gel that wraps around the carbohydrates in your meal and slows their absorption to a crawl. The sugar releases steadily, so you avoid the spike and crash that leaves you shaky and hungry an hour later. Chia also carries a plant-based omega-3 fat that helps calm the low-grade inflammation underlying insulin resistance. 1 to 2 tablespoons a day is all you need, stirred into yogurt, dropped in water with a squeeze of lemon, or blended into a smoothie. Give it 10 minutes to gel and drink plenty of water alongside, because all that fiber needs liquid to move. The sixth food is fatty fish, salmon and mackerel specifically. This one does not work by slowing your meal down. It works on the deeper problem, the chronic inflammation that drove your cells to become resistant to insulin in the first place. Salmon and mackerel are loaded with 2 omega-3 fats, EPA and DHA, which are among the most powerful natural anti-inflammatory compounds we know of. They lower the inflammatory signals, the cell membrane becomes healthier, and the insulin receptor starts working as it should. In my 15 years of clinical practice, the patients who eat fatty fish twice a week consistently have calmer, more stable numbers and better blood pressure alongside them. Aim for 2 servings per week, roughly palm-sized each. Wild salmon, mackerel, sardines, and herring are all excellent. Canned versions are some of the cheapest, most nutritionally powerful options on this list. Seventh are walnuts. Of all the nuts, this is the one I steer my patients toward first because of what it does for the lining of your blood vessels and your insulin levels simultaneously. Walnuts are rich in polyunsaturated fat and the same plant-based omega-3 found in chia. That fat improves the function of your endothelium, the thin lining inside your blood vessels, which is one of the first things high blood sugar damages. The fat, fiber, and protein in walnuts also blunt the rise in blood sugar after a meal and have been shown to lower fasting insulin, which is the number that tells you how hard your pancreas is straining. A small handful, about a quarter cup or 7 to 10 whole walnuts, raw or dry roasted, used to replace a processed snack rather than added on top of one, is all it takes. The eighth food is eggs, whole eggs, yolk included. For years, patients were told the yolk was the enemy, and that bad advice pushed people toward sugary breakfast cereals that were far worse for their blood sugar. Let me be clear, a whole egg is almost pure protein and fat with virtually no carbohydrate, which means on its own it barely moves your blood sugar at all. The real value is what physicians call the second meal effect. When you start your day with eggs instead of toast or cereal, you steady your blood sugar not just at breakfast but all the way through to lunch. The protein and fat also keep you full, so the mid-morning cravings that send you toward the cookie jar quietly disappear. In my practice, swapping a cereal breakfast for 2 or 3 whole eggs is one of the single fastest changes I see reflected in a morning glucose reading. Scramble them, boil them ahead for the week, fold in some spinach, and put that avocado right on top. You have built a near-perfect blood sugar breakfast. The ninth food is apple cider vinegar, and this is the one with the fastest visible effect on a glucose meter of anything on this list. The active ingredient is acetic acid, and it does 2 things at once. It slows your stomach from emptying so the carbohydrates in your meal arrive in your bloodstream gradually, and it helps your muscles pull glucose out of your blood and use it for fuel. Research led by Dr. Carol Johnston at Arizona State University found that 1 tablespoon of vinegar before a carbohydrate meal lowered the after-meal blood sugar spike by roughly 20% in people with insulin resistance. That is a clinically meaningful result from something that costs a few dollars per bottle. Take 1 tablespoon diluted in a full glass of water 10 to 15 minutes before a carbohydrate-containing meal. Always dilute it. The acid is harsh on tooth enamel and the throat if taken straight. And if you are already on blood sugar medication, speak with your doctor first, because this combination can lower your sugar faster than expected. The 10th food is lentils, and this one proves the entire point of this video. Lentils are a carbohydrate, and they will lower your blood sugar. Here is how. Lentils are built from a slow carbohydrate called resistant starch, wrapped in soluble fiber and a solid dose of plant protein. That combination means glucose is released into your blood slowly and steadily over hours, rather than all at once. They also carry the second meal effect, so a bowl of lentil soup at lunch gives you steadier numbers into the evening. Clinically, swapping white rice or white potato for lentils a few times a week is one of the most reliable strategies I know for bringing an A1C down, that is your 3-month average blood sugar. Aim for half a cup to a cup of cooked lentils several times a week, in a soup, stew, or cold salad with olive oil and a splash of the vinegar we just covered. They are filling, affordable, and they stretch a meal further than almost anything else. Let me tell you about a patient I will call Donna, 63 years old, recently retired. She came to me frightened because her fasting sugar was sitting around 180, and her doctor had just told her it was time to add a second medication. She did not want to spend the rest of her life climbing the medication ladder, and she was scared because she had watched her own mother lose toes and then her eyesight to this same disease. We did not cut her carbohydrates to nothing. We added eggs and avocado in the morning instead of cereal, a tablespoon of vinegar before her bigger meals, lentils in place of white rice, walnuts instead of her afternoon cookie, fatty fish twice a week, cinnamon in her coffee, and broccoli sprouts on her sandwich at lunch. Within the first week, her fasting numbers started dropping. Within 3 months, working closely alongside her own doctor, she had come off that second medication entirely, and her A1C had moved from the diabetic range back toward normal. 2 years later, it has held. She did not starve herself. She ate more food, just the right food, and her own body did the rest. Let me tie all 10 together, because this is the reason they work when cutting carbs alone fails. Every one of these foods is handing your insulin its job back without starving you. The fiber-rich foods slow the glucose down so your pancreas never has to go into crisis mode. The fish, walnuts, and chia cool the inflammation that was jamming the signal. The cinnamon and the vinegar work directly at the insulin receptor and help it grip again. Do that meal after meal, day after day, and the cell that stopped answering the door slowly starts opening on the first knock again. That is what reversing insulin resistance means at the cellular level. And once it happens, your body holds your sugar down on its own, which is exactly why Donna's numbers stayed low for 2 full years. Before I give you tonight's plan, I need to draw one clear line. If you are on insulin or a sulfonylurea, one of the older blood sugar pills, these foods can lower your sugar fast enough that your medication dose may suddenly become too high, which can drop you into a dangerous low. Add these foods with your doctor monitoring your numbers and let them reduce your medication dose as your body improves. Do not stop any prescription on your own. Bring this list to your next appointment instead. Here is what to do starting tonight. Tomorrow morning, replace your cereal or toast with 2 or 3 whole eggs and half an avocado. That single swap changes your blood sugar trajectory for the entire day. Tonight, soak a teaspoon of fenugreek seeds in water and drink them first thing in the morning. Buy Ceylon cinnamon and start a 1/4 teaspoon per day in your coffee or oatmeal. Before your biggest carbohydrate meal tomorrow, take 1 tablespoon of apple cider vinegar in a full glass of water 15 minutes ahead. And this week, swap white rice or white potato for lentils at least twice and put fatty fish on the menu 2 nights. Stack these changes in over the next 2 weeks. You are not removing the foods you love. You are adding the foods that protect you and giving your body exactly what it needs to do what it was always designed to do. The beauty of this approach is that it is cumulative. Each food reinforces the effect of the others. The fiber slows the glucose, the omega-3 fats cool the inflammation, the polyphenols and acetic acid help the receptor grip, and the resistant starch keeps your numbers even between meals. When you stack them together, the result is far greater than any single food on its own. Now, everything we covered today brings your sugar down during the day and after meals, but many of my patients have told me the same puzzling thing, that their highest reading of the entire day comes first thing in the morning, before they have eaten a single bite. They fasted all night, and their sugar went up anyway. There is a specific reason your liver does that while you sleep, and there is a way to address it. I have put together a dedicated video that explains exactly what is happening overnight and how to wake up to a lower number. Go watch that one next, and I will see you there.